Hello, I'm Dr. Tom Sullivan, orthopedic surgeon at OSMS. We all understand that being active as an adult, whether it's in sports or fitness programs, is an important element to staying healthy. However, as we get older, being active can also seem to lead to nagging aches and even chronic pain. Here are 3 common questions active adults ask orthopedic surgeons. Both shin splints and patellofemoral pain syndrome, or runner's knee, are overuse injuries. This means the pain and inflammation is caused by repeated stress put on those specific areas. Shin splints occur when the muscles, tendons, or tissues around the tibia become inflamed. This results in pain and mild swelling along the inner side of the tibia. Patellofemoral pain is often described as a dull, aching pain at the front of the knee. Activities that can cause this condition include running, jumping, and squatting, as they all put stress on the front of the knee. Other overuse conditions include stress fractures, which is a small crack in the bone due to overuse or extreme stress, and tendonitis, which is inflammation of tendons that results in chronic pain. Most of these conditions can typically be treated with non-surgical methods like rest, ice, compression, elevation, and activity modification. Wearing proper fitting shoes while running or playing sports is one of the easiest ways to help prevent these overuse conditions. It's also important to gradually increase the frequency, intensity, and length of activities. For runner's knee, physical therapy may also be recommended to help improve the strength and flexibility of muscles around the knee, which can help reduce the amount of stress that's put on the knee during activity. Unlike an overuse condition where the symptoms start gradually and get worse over a longer period of time, or when doing a certain activity, the symptoms of an injury will typically develop more suddenly and can be felt more consistently. For example, let's look at a meniscus tear. When this injury occurs, people may feel a popping sensation in their knee, but oftentimes they can continue to walk or even participate in other activities. However, within a few days, stiffness and swelling in the knee will continue to get worse. Other symptoms include catching or locking in the knee, and a feeling of weakness, like the knee might give out. Also, an injury like a meniscus tear will reduce a person's overall range of motion. Another injury common in active adults is a rotator cuff tear. This injury can actually be the result of repetitive stress or overuse that wears down the tissues of the rotator cuff. However, if a tear occurs, it will result in symptoms similar to a torn meniscus, such as weakness and pain when lifting or rotating the arm, and pain during specific activities, and also at rest. Another indicator that nagging chronic pain is the result of a more specific injury is if it doesn't respond to things like resting, icing, activity modification, or taking non-steroidal anti-inflammatory medications like ibuprofen. Two of the biggest factors in deciding when surgery is needed are number 1, how the injury is responding to non-surgical treatments, and number 2, the person's desired activity level for after recovery. For example, we might recommend surgery for people who want to return to sports, higher intensity fitness programs, or those who have jobs that require overhead lifting or reaching. Other signs that surgery may be a good option: your symptoms have lasted more than 6 months, and overall function is low due to weakness or reduction in range of motion.